Okay, let's be real. Parenting is not easy, but you are not alone. Welcome to the Parent Prescription, a podcast where I will give you real, practical advice to help navigate the ups and downs of raising healthy, happy children without losing your mind. Today's episode is especially important as we focus on mental awareness in pediatrics, something that continues to impact more and more families every single day. Mental health is just as vital as physical health, yet it's often harder to recognize, talk about, and address, especially in children. In this episode, we're breaking down the top 3 most common mental health diagnoses we see in pediatrics: anxiety, behavioral disorders like attention deficit, hyperactivity, and depression. We'll talk about what these conditions can look like at different ages, warning signs for parents that we shouldn't ignore, and how you can support your child both at home and with professional care. Our goal today is simple: to help you feel informed, empowered, and better prepared to advocate for your child's mental well-being. Let's get into this dose of dollars. May is Mental Health Awareness Month. And so I wanted to take this first day of May, Friday, May 1st, to discuss mental health in pediatrics. And so when we think about mental health, a lot of times we think about adults. We don't think about children, right? But mental health can start as early, you can see signs as early as 6, 9 months old, depending on things that are happening in the environment. And so let's get into the top 3 things that we see in pediatrics so that you can be aware that these things are happening and so you can know what to do if you see signs of these things, okay? And so the number one thing that we see, which would probably be surprising to you, is anxiety. Anxiety is an umbrella. We have generalized anxiety, we have separation anxiety, we have social anxiety, we have phobias or fears. Again, you can see these very early in children. Approximately 11% of children, at least 1 out of every 10, are diagnosed or should be diagnosed with anxiety. So when we think about anxiety, what is that? That is a overwhelming, persistent worry or fear about something, okay? And so initially it's generalized anxiety. It doesn't have to be about something specific, just an overwhelming fear that something bad is going to happen, that there's things that are going wrong, and it overwhelms them. Whereas they can't get their daily things done. Normal things that we expect for that age are unable to get done due to fear or worry, okay? These things are usually screened in our preteens and teenagers. However, if there are things that come up that parents bring up in our younger children, we will start to screen earlier than that, okay? Anxiety, generalized anxiety, is initially taken care of with just counseling, therapy, so that they can figure out how to understand their emotions and that some of them are reasonable and legit, and understand what to do with their emotions, what to do with those feelings, how to tell if your body is going into a fight or flight or going into these fear when your heart rate's increasing. And so counseling, you'll hear me say that a lot in this episode. Counseling is going to be the basis of a lot of this. And so we want to make sure that we are using our therapists and our counselors and our social workers that we have available in town to help us with these diagnoses and to get to the result or the help that the children need. Another one is separation anxiety. When we think about that, we think about it can start in babies. Sometimes, depending on the age of the child, it can be pretty common, pretty typical between 9 and 12 months for a child that's not been in a daycare setting, if not going around a lot of people. If they get in a place where they have to leave mom or dad, where they're clingy or they don't want to go to anyone else, that's typical. That's not abnormal behavior, okay? But when we're time to transition to a school setting and we literally cannot, now the first couple of weeks, we know that's typical. But when we can't transition into a school setting, we can't separate from mom when it's time to go to bed, from mom or dad when it's Bedtime, we literally cannot make that separation. It's a fear or an anxiety, a stress. It's seen. Those things are things that we have to address, even with our young ones, even with our little kiddos. Sometimes events, life circumstances can make us have signs of anxiety, and it's because of a situation, a divorce, parents separation, a big move. Those things can be stressful and can cause anxiety at that time. But again, counseling, discussing it, explaining things to children, those things help. Social anxiety, when children cannot perform in certain settings, where they're just fine when they're at home or in small settings, but when they go into a basketball game or they want to play soccer and they cannot because it's too many people, or a performance anxiety when they know everything, but when it comes to taking the test, it's it does not come out the way that you know that they have it in their head. These things are not as rare as we think they are. These are under the umbrella of anxiety. And anxiety, if we leave it untreated, it can create other issues. Complaints of belly aches and headaches and wanting to miss school and wanting to withdraw. And we wonder if there's something else wrong because we are leaving it untreated. When I say untreated, I do not mean just medicine. I think that's one of the things that we get nervous or concerned about, is that I don't want my kid on medicine, right? But medicine is not the first answer to these mental health disorders. Medicine is not the first answer. Sometimes it's needed. Just like we treat a headache, we need to treat ADHD. But sometimes we can do just with changing the environment, making sure we're communicating more, and counseling. Therapy is helpful. Okay. Let's talk about that second one, which you may have heard a little bit more than the anxiety in children. And that is behavioral disorders. The top two most common ones are going to be our signs and symptoms of ADHD, attention deficit hyperactivity disorder, and oppositional defiance disorder, ODD. Most likely you've heard of the first one, the second one, possibly. And so ADHD is, at this point, most people know what that is. It's diagnosed usually around the age of 5 or 6. It could be a little bit older depending on the child. You do have more diagnosis in boys, but I think it's just because it's easier to recognize with the hyperactivity. But it is a impulsive disorder where I am acting before I think a lot of times. I'm moving like I'm on a go, on a green light, like the Energizer Bunny. Um, I know the information, but I'm rushing too fast, so I can't get the information out of my head onto the paper. Sometimes my handwriting is really poor because I'm moving too fast, or I read the passage way too fast, so I'm not getting the information. Um, Sometimes I have boundary issues, as far as not knowing what to do in certain situations because I'm moving too fast. Um, ADHD is not necessarily bad behavior. It's not bad behavior. It's I cannot slow down sometimes to make the right choices. And so we as parents have to realize, yes, I understand that children are going to be kids are going to be kids, but about 7 to 8% of children are diagnosed with these disorders that can affect not only their thoughts about school because they're trying really hard, but they're getting in trouble for getting up and down out of the seat or talking out of turn, or things that we say, oh, that's just children. But then, even though I'm trying hard, I'm not getting happy faces, or I'm not getting the grades that I know I can get. And so it starts to affect my self confidence, or how I don't want to go because I'm trying and I'm getting in trouble. We have to also think about the consequences of not treating these things. Occupational therapy is helpful when we talk about a short attention span because it helps with slowing down, handwriting, being able to button things because I'm moving too fast, I can't get it, but it helps with those things. So we talk about therapy, not only behavioral therapy, but also occupational therapy helps with those things. Okay, and so again, therapy is the first choice, not medication. And so when we say, hey, let's try behavioral therapy for a while, or when your pediatrician says, try behavioral therapy for a while, that's not a knock on your parenting. That's a, let's see if this works. It takes a team of effort of things to try to understand the behavioral portion of these disorders. And that helps the child understand what's going on with them too. And so take the things, the advice that's given, and try those things first. It also can affect sleep. And you know, if you don't get good sleep, you can have poor sleep. Okay. Oppositional defiance disorder. And so these are, when we think about that, these are the kids that when you say left, they say right. When you say the sky is blue, they say, well, it has some green in it too. Okay. Now, that could be a personality thing, of course, but it also can actually be a diagnosed condition called oppositional defiance, where I basically bump up against anything that's said. I have a issue with what's told to me, not necessarily from authority, just period. I'm going up against what is told to me because I want to see it the way that I see it and do it the way I want to do it. Okay. Now, why is that a concern? That's a concern because when it comes time to saying this is how you have to behave in the classroom or even at home, it can be a problem. If you have one child that has oppositional defiance and we haven't started therapy, we haven't given medicines if needed, then it can affect the whole family. We were going to go somewhere, but we can't go because we already know how he or she is going to behave, correct? And so we have to make sure that we factor these things in because oppositional defiance, if untreated or disregarded, can turn into or become a young adult with a conduct disorder. So when you talk about those young adults that enjoy fighting, that enjoy that the end up going to jail over things that could be super simple and fixed, but because authority said something or police officer said something, they went up against it and it ended up in a bad situation when it didn't have to. We talk about thieves and stealing, and those things happen. And sometimes it's because we didn't even take care of oppositional defiance when they were little. Okay. And so does it always go into conduct disorder? Absolutely not. But can it? Absolutely. Let's be proactive and take care of things ahead of time. Okay. So the last one is depression. When we think about depression, we think about adults, or most people do, adults. But it is getting more and more common for young people to have depression. Really sad fact, but that's true. 4 to 5% of children, starting at the age of 5, shows depression. I want to give you some statistics. Now, these are 2023 numbers because that's what's out right now. And so after doing research and things on depression and suicide, here's some numbers for you, okay? 18% of adolescents, 18% reported symptoms of depression in the past 2 weeks. 40% reported feelings of sadness and hopelessness. 20% reported seriously considering attempting suicide. And 16% reported actually making a suicide plan this year, in the past year. Now, these are slightly older statistics. And so, unfortunately, the number is probably a little bit higher than that. Okay? When we talk about mental health, I'm going to give you a few numbers of that too. 22% of our adolescents, 12 to 18, showed reported drinking alcohol in the last month. 17% reported using marijuana. 4% reported using prescription pain medicine, not for their pain. Okay. And so why does this matter? Because substance abuse is also under mental disorders, mental health. Okay. And can, if unseen or disregarded or unknown, can lead to other things. A lot of times these things go together. Okay. When we talk about comorbidities, we're talking about if you've got a short attention span or impulsiveness that's untreated, not discuss, guess what? Impulsively, I can decide to try something that somebody hands me, right? And so this goes, if we don't take care of it, it can lead to other things. Okay. And so that was just a few. I just wanted to throw those out there. So childhood depression can be seen very early when we talk about children that you go, okay, I've just got an emotional child. She cries a lot. Okay. But if you start to think about when that started, did it start after grandma passed away? Did the emotion, the sensitive, or is that just her personality? Or would you say, no, she likes to be in a room with the lights off and she cries all the time? Or she always says that she's sad or she wants to be up under me because she's scared all the time, right? So we've got to think outside of our feelings. Oh, children don't go through anything. Some grief is real and it lasts a certain amount of time, but if it's prolonged, we do have to say, wait a minute. Are we showing signs of childhood depression or is this just typical grief? These are reasons to go to the doctor and say, oh, this is lasting a little longer than I thought it would in a child. Okay. Childhood depression can lead to other things when we don't want to be the parent that say, I didn't know. I didn't know when we talk about our young people taking prescription drugs or suicidal attempts, suicidal thoughts, those things that are screened at the doctor's offices. Those are screened. But if we're unaware, if you don't bring them to their wellness visits and we don't know what's going on, because surprisingly, children will put the information down. When you do the screenings, you wouldn't believe what parents find out. And so this information is just for you to at least swallow and realize that these illnesses, these disorders are not as rare as we think they are. So we're talking 8 to 11% of children that are diagnosed with some type of mental health disorder that we need to be proactive in taking care of them so that they can be the best version of themselves. Okay. Don't let it be taboo to you. Don't let counseling be a taboo word. It's not. We need to make sure that we're using, just like we would treat a broken arm, we should treat our mind. Okay. So this is May is Mental Health Awareness Month. You may get more information here. I just wanted to grab the most common ones so that you can hear about those. But there's so much more I could say, but I didn't want to prolong this. I want to make sure that you are aware of the common things. If you have comments or information that you want to put below, please do. Please share this so that more and more of our young adults and adults that have children can know what to look for, signs and symptoms, things to look for, when to take their child to the doctor to get evaluated. But let's be proactive parents, okay? Not reactive. Have a great week. Thank you for joining me on The Parent Prescription.